set of symptoms are a really persistent dry cough, fever, and shortness of breath. Those are really the most common symptoms. We're learning now that many times people may have some loss of smell or loss of taste as an associated finding. Some may have some gastrointestinal symptoms also, but the classic symptoms are fever, shortness of breath, and cough. Notice that during the week when many students were off, that things were really progressing quite a bit. So in advance of the return back to campus and the resumption of classes, here at the Health Service specifically, we made some really important operational changes to anticipate that there might be a rush of students. We started thinking about some ways to redeploy some of our clinical staff to make sure we had sufficient personnel available to take care of the urgent folks who were to come in exhibiting symptoms. I give the executive officers and the president a lot of credit. I know he was interviewed by the Daily last week, and I agree with his statement that the university responded pretty quickly after the students returned from spring break by making a change. And based upon what we know about the virus, it was pretty clear that anyone who had contracted the virus during that last travel weekend might predictably start exhibiting symptoms within that first week back. So I think that decision to cancel classes on that Thursday and Friday and then move to remote education was just in time. We continue to have a number of essential staff here on site dedicated to the screening of individuals, and we also have redeployed some folks to try and make sure that we can address the issues related to COVID. We're still able to see students either on site, and we're actually expanding our capability of seeing students through video visits, which I think will offer us a lot of flexibility in terms of staying connected with students who may have new needs or continuity of care needs. The recommendation is to call first, and we have, as I stated previously, expanded our staffing around the phone for screening and doing triage so that depending upon whatever complaint it happens to be, we're able to connect the student to an appropriate resource. That might just be advice, that might be recommendations to come in at a specific time for an assessment and testing, or it might be directing them to a video visit or something like that. So we just recommend call first. But here at the Health Service, we have, as I mentioned before, restricted access to a single door so that we have control over the folks coming into the building, and we do screening of everybody who comes in the door. And more recently, we've gone to a complete masks on approach to both everyone who comes in seeking care as well as all of the staff in the clinical area. So everyone's wearing a mask now. That's just a sort of uniform precaution that's across the board. I did mention also that we still have this separation of space for folks who present with respiratory complaints, and we're moving anyone who's a suspect corona patient into that more isolated area. And any of our staff who come in contact with a patient who is suspect corona has full personal protective equipment, including eye protection, masking, gowns, gloves, and a whole set of protocols for how that putting the protective equipment on and taking the protective equipment off to prevent contaminating oneself is in place. I guess I'd start by just acknowledging how disruptive this has been for students. I'm a parent of a couple of college students myself, including a U of M student, and I see how frustrating it is that students aren't getting the experience that they had hoped for. And yet, the importance is to, observe the social distancing guidelines. It is the best way to try and halt the rapid spread of this infection. So I think staying home and avoiding crowds is really, really important and must be taken seriously. I think really paying attention to Hand hygiene practices is important, so frequent hand washing and really trying hard to avoid touching the face is really important. And there's an element of environmental controls too. So we do know that the virus can be transmitted from surfaces, and that's, I think, probably less likely than the direct person-to-person contact, and yet there is a role for keeping some sanitizing wipes for high-touch surfaces like tabletops or keyboards or door handles or cell phones even. So being aware that keeping your cell phone clean is another good strategy.